Hi, I'm Dr. Mariah White, here to discuss recurrence and survival outcomes following percutaneous thermoablation of oligometastatic melanoma. This will appear in the Mayo Clinic Proceedings March 2016 edition. The purpose of this project was to retrospectively evaluate if any potential extended survival benefit exists in a select patient population undergoing percutaneous focal thermal ablation of metastatic melanoma. In this study, we evaluated all patients who underwent image-guided local thermal ablation of metastatic melanoma over an 11-year period at the Mayo Clinic, Rochester. We limited our study to those patients with 5 or fewer melanoma metastases that were amenable to complete ablation of all clinical disease at the time of treatment in our analysis. This included 33 patients with primary ocular and non-ocular melanoma with a sum of 66 metastases treated in the liver, lungs, bones, adrenals, and soft tissues. Figure 2 outlines the median progression-free survival. This Kaplan-Meier curve shows the median progression-free survival for all patients completely treated with thermal ablation techniques was 4.4 months with an estimated 1-year progression-free survival of 30.38%. Figure 3 outlines the median survival time. This Kaplan-Meier curve shows the median survival time was 3.8 years, with a 4-year estimated survival of 44.1%. So how do these results relate to clinical practice? The current treatment recommendations for this select population primarily consists of surgical excision of these metastatic lesions in addition to systemic medical therapy. Table 2 demonstrates that large prospective and retrospective studies, both single and multi-center, have demonstrated patients who undergo complete surgical excision of their limited metastases have a predicted median overall survival ranging from 15.8 to 36.7 months, compared to our 45.2 months. These patients also demonstrate a 5-year overall survival ranging from 20.5 to 33%, compared to our 30%. The treatment discussed in this paper of complete percutaneous thermal ablation of metastases aims to achieve the same cytoreductive effects as surgery. The takeaway message is that selective use of image-guided thermal ablation of oligometastatic melanoma may provide similar results to surgical resection in terms of technical effectiveness and oncologic outcomes with minimal risk. As this relates to clinical practice, thermal ablation of such metastatic disease may be considered an alternative to surgery in select patients. For patients, these findings support thermal ablation as a potentially minimally invasive therapeutic alternative to surgery in those with 5 or fewer melanoma metastases. The next step in this line of research would be further prospective studies comparing the efficacy of ablation techniques with surgery in this select patient population to validate our findings. Thank you for your time.
We hope you found this presentation from the content of Mayo Clinic Proceedings valuable. Our journal's mission is to promote the best interests of patients by advancing the knowledge and professionalism of the physician community. If you are interested in more information about us, our homepage is www.mayoclinicproceedings.org. There you will find access information for our social media content, such as additional videos on our YouTube channel or journal updates on Facebook. You can also follow us on Twitter. More information about healthcare at Mayo Clinic is available at www.mayoclinic.org. This video content is copyrighted by Mayo Foundation for Medical Education and Research.